Well, I think we are now entering a complete new era of pacing. With this concept of conduction system pacing, and more specifically left bundle branch area pacing, we are really heading towards a complete new pacing modality for our patients. We really want to not only capture the heart to make sure that we have sufficient heart rate, but we also want to make sure that the myocardial contraction is as normal as it would be without a pacemaker. And that's what we are achieving right now. So this is a great step into the future. What we really want to avoid with left bundle branch area pacing is that our patients would have any detrimental effects of their pacing. What has been the case with RV pacing, with right ventricular pacing, we know that patients can develop pacing-induced cardiomyopathy. They really can get heart failure based on their pacing, and that's what we are currently avoiding with left bundle branch area pacing. The tag that you can add on the initial screen, the home screen, that indicates that this patient has left bundle branch area pacing. This will definitely ease our workflow also for our technicians. Well, I see the Amvia family in terms of pacemaker as the next generation of the pacemaker. There are a lot of features which have been enhanced, like the MRI guard, like the early and the quick check. I think these are all features which optimize our workflow in clinical practice. What I also think that's a very important advantage for the patient is an increased battery longevity, which is going up to 14 years right now, together with an increased warranty. What is really important, at least for us in our implant technique, is that we really aim for a nice perpendicular position on the septum, because you really want to get towards the left side of the septum to capture the left bundle branch, or at least a direct area of the left bundle branch. So therefore, achieving this perpendicular position to start your screwing process is really essential for us. What we currently really appreciate with the BIOTRONIK tools is that they developed a dedicated delivery sheet for conduction system pacing, the Selectra 3D sheet, which has a double curve, and this really helps us to obtain a perpendicular position on the septum, and it's quite confident to achieve in different patients with different anatomies this nice perpendicular position. An advantage of the new Amvia pacemaker family is also the MRI guard, because now we can easily program the patient to be able to undergo an MRI for the 1 year ahead. And this is really easing our workflow, not only for our staff, but also for the staff of the radiology department. The Amvia CRT-P family now allows us to optimize the resynchronization therapy by offering more pacing configurations, more pacing vectors, but also has the algorithm, the CRT Auto Adapt, which allows us to automatically adapt the pacing parameters to our individual patients.